Before using the BD ChlorPrep patient preoperative skin preparation with sterile solution 26 milliliter applicator, please review the individual applicator label accompanying the product for full directions for use and safety information. PDFs of the product labels are included on our website. Do not use the 26 milliliter applicator for head and neck surgery or on areas smaller than 8.4 inches by 8.4 inches. Use a smaller BD ChlorPrep applicator, such as our 10.5 milliliter size. BD ChlorPrep patient preoperative skin antiseptic should be applied to clean, dry skin. When hair removal is necessary, the preferred method is to use a surgical clipper the morning of the surgery. Use in accordance with the policies and procedures of your hospital. The BD ChlorPrep patient preoperative skin preparation with sterile solution 26 milliliter applicator is easy to use. Simply pinch, apply, and allow to dry. The applicator's patented design allows for easy activation while promoting aseptic technique by keeping hands away from the patient's skin. To get started, remove the 26 milliliter applicator from its packaging, making sure to practice aseptic technique. Do not touch the sponge. Activate the applicator by holding it with the sponge in a downward position parallel to the ground. This position allows the solution to properly load into the sponge upon activation. Using your thumb, simply press the lever only once to activate the applicator, releasing the antiseptic. Release the lever and allow time for the solution to partially load into the sponge. The applicator's unique design controls the flow of the solution for smooth delivery. Do not shake or press the lever multiple times. It may be necessary to use two hands to press the lever. With the solution now partially loaded, gently press the applicator against the treatment area to distribute the solution throughout the sponge. Once the solution is visible on the skin, use gentle, repeated back and forth strokes to prep the incision site. Allow the recommended time at the incision site before progressing outward to the periphery. Antiseptic should always be applied from areas of least contamination to most contamination as appropriate per guidelines. For dry surgical sites such as the abdomen or arm, use gentle, repeated back and forth strokes of the sponge for approximately 30 seconds. Completely wet the treatment area with antiseptic. Allow the solution to completely dry without blotting or wiping away. For moist surgical sites, such as the axilla or inguinal fold, use gentle, repeated back and forth strokes of the sponge for approximately 2 minutes. After you have completely wet the treatment area with antiseptic, allow the solution to completely dry. Do not allow the solution to pool. Use prep towels to absorb any excess solution. Remove any saturated soaked materials, towels, and gowns from the prep area before draping. When you're finished prepping, discard any portion of the solution not required to cover the prep area. It is not necessary to use the entire amount. Always discard the applicator after a single use. If multiple insertion or incisional areas are indicated within the surgical treatment plan, each area must be treated equally for the recommended prep time. It may be necessary to use multiple applicators depending on the surgical areas. If multiple applicators are used, it is not necessary to start at the insertion or incisional area if you have completed the appropriate prep time for that section. As the solution dries, the sheen becomes less apparent and takes on a matte appearance. For optimal adhesion, make sure the area is completely dry before applying drapes or dressings and before using an ignition source such as a cautery or laser. Complete drying time requires a minimum of 3 minutes on hairless skin and up to 1 hour in hair. Avoid getting the solution into hairy areas. If incised drapes are being used, apply directly to the dry prepped area. The BD ChlorPrep sterile solution is flammable. Always use BD ChlorPrep products in a well-ventilated area because the solution contains alcohol and gives off flammable vapors. Your site is now prepped and ready.